press the bell icon and never miss a video from the Aesthetic Clinics and Dr. Debraj Shome. One substance which has taken the world by storm is botulinum toxin, also called Botox. Botox is what is keeping the world younger. Botox is what is making all the Bollywood and the Hollywood celebrities appear younger than they are. So what is Botox? Botox is a molecule which goes in and relaxes your muscles, and by relaxing your muscles it goes ahead and removes the superficial lines. So when you are raising your forehead or you are smiling, there are lines which appear on your face, and these can be removed with Botox. As the Botox goes ahead and acts, it's like making sure that if it's a bed sheet, it's starched, so there is no crumpling of the bed sheet. So it prevents any crumpling or any wrinkling of your overlying skin. How is this injected? So basically you go ahead and you open this. This has now been opened, right? Inside you have the Botox vial which is sealed. This vial is a 100 units vial. There are also 50 units vials which are available. So Botox actually is a powder. If you look carefully, you will see that there is actually appears as if there is nothing in this vial. It appears empty even, right? But there is obviously stuff which is required inside. Then you go ahead and remove this particular thing, and now you have the bottle. This bottle is reconstituted with normal saline. The saline which you take when you have dehydration, etc., the same normal saline. So here we are going ahead and taking a 1 ml syringe, a BD syringe, with a 26 gauge needle, and this 26 gauge needle is being utilized in order to fill it with saline. So I'm pulling normal saline into the 1 ml syringe. So you can see now 1 ml normal saline has been pulled in. This 1 ml normal saline, you go ahead and insert it into the botulinum toxin or the Botox vial. The moment you do that, if the vial is fresh, you will see that this can pull in the solution by itself because it is vacuum frozen and it is sterilized or with no air inside. So now this Botox vial has 1 ml. Here 1 more ml of normal saline has been taken from the same bottle. This 1 ml, like the earlier 1 ml, is also put into the Botox vial, and you can see it's being pulled in. The plunger is being pulled in by itself. So now this 100 units vial has 2 ml of normal saline. If 2 ml of normal saline contains 100 units, then every 0.1 ml now contains 5 units. That's the thing to remember. So every 0.1 ml of this solution that you inject will have 5 units of Botox. I'm removing this now and gently moving it from side to side. So as a result of which now the botulinum toxin has been completely reconstituted. Now I'm going to teach you one life hack which will go ahead and teach you how to use the Botox better. So what we are going to go ahead and do is to actually remove the outer cover with a stapler, the back of a stapler. This outer ring of metal can now be removed. Why are we doing this? So that we can now go ahead and remove the rubber, right? Why is this necessary to remove the rubber? Because of two reasons. First, you have to understand that the rubber blunts the needle tip as it goes in. We'll be using this particular insulin syringe for injection into the patient. When you go ahead and put this inside, it will actually lead to the needle tip becoming blunt. When the needle tip becomes blunt, your patient will face more pain when you are injecting the botulinum toxin. No patient wants pain. Think of it yourself. You want to have a comfortable experience. So by making sure that you're not going through the rubber, you prevent this from becoming blunt. The second thing is, if you keep the rubber in, you won't be able to remove the last drop of Botox from the entire vial. Botulinum toxin or Botox is an expensive drug. If you're going to leave 0.1 or 0.2 ml, you're losing about 10 units of Botox. Considering that the MRP of this is approximately 19,000 rupees, 0.1 or 0.2 ml, which contains 10 units, will cost you approximately 1900 or 2000 rupees, which will not be fair on the patient. So for these two reasons, we go ahead and remove this in this particular manner. Now we have to take this reconstituted Botox. So the reconstituted Botox is going to be taken into this 31 gauge needle and this insulin syringe, which is 1 ml with 40 unit gradations which are present on it. So this will be taken to pull the botulinum toxin in. This looks just like the saline that you had inserted, but remember that this now has the Botox in it, which has been reconstituted. So now you have 1 ml of this solution. As you remember, 2 ml contained 100 units. So 1 ml contains 50 units. So every 0.1 ml or every 5 gradations, you will go ahead and have 5 units. So that is the thing to remember when you go ahead and inject. This botulinum toxin or Botox is now ready for injection and you can use it. Now you've injected Botox whichever was required. The remaining Botox can be stored in the door of your fridge. The package insert here from the company Allergan says that you should use it within 4 hours. We published a paper back in 2010 which was published in one of the topmost American journals called Dermatologic Surgery. You can check it online. It will be in my name, which is Debraj Shome. I'll be the primary author. We proved that Botox, if it is reconstituted and then stored in the fridge, you can store it for even 6 weeks and the results will remain the same. So don't believe what the package insert tells you. Don't rush to throw the Botox aside just because it says 4 hours. Botox can last up to 6 weeks. It has been proven unequivocally by keeping it in the fridge. So now go ahead and store it immediately. Keep it in the fridge and you are safe and you can use it for the next patient. This is important because some doctors go ahead and charge a patient. You might be injecting only 25 units, but they charge the patient for the entire 100 units vial. How is that fair? If I am going to be eating only 1 burger, why do you want to charge me for all the 4 burgers which are there? So from that perspective, these life hacks will teach you how to store the Botox well, and it will also ensure that you and your patient have a wonderful experience. Thanks for listening.
Hello, I'm Dr. Debraj Shome. I'm a facial plastic surgeon. I trained in the United States, Singapore, Europe and India, and now currently I'm practicing in Mumbai, India. Facial plastic surgery is a specialty in which plastic surgeons train only in surgeries of the face. This is a very nascent specialty in India and there are only 3 or 4 surgeons in the whole of India. Thank you for allowing us to participate in your case.
Thank you for listening. Do not forget to share, comment, like and subscribe to our videos from the Aesthetic Clinics and from Dr. Debraj Shome.